Informed consent prior to immunization, combination visit, initial and subsequent vaccine series, i.e. 12 months. Health clinic visits involve complex conversations, including informed consent, health assessments, and other health issues. There is a difference between obtaining informed consent to immunize and deciding to do the actual immunization. The health assessment and eligibility and contraindication determination are aspects of the decision to immunize using clinical judgment. These are all outside the scope of obtaining informed consent. The purpose of this demonstration is to focus on obtaining informed consent prior to immunization. The process for obtaining informed consent consists of 7 steps. Step 1. Determine authority.
Hi, my name's Liz and I'll be immunizing Molly today. Are you Molly's mom?
Yes.
And are you here for Molly's 12-month shots?
Yes.
Step 2. Assess capability. Throughout the appointment, the vaccine provider assesses the parent's capability to give consent, taking into consideration such issues as cognitive functioning, hearing, and language barriers. Step 3. Provide standard information.
Okay, great. Now, as you remember, when you brought Molly in for her first shots, we discussed that your consent was for all the doses in the series to protect her against those diseases, which include meningococcal C and pneumococcal 13. The MMR and varicella chickenpox are given on or after your child's first birthday, so she hasn't had these vaccines yet. Now, these vaccines are the best way to protect Molly against these diseases, which can be serious and sometimes fatal. These vaccines are very safe, and it's much better to get the vaccines than to get measles, mumps, rubella, or chickenpox.
Okay.
Now, have you had a chance to read through the health files for the vaccines that Molly's due for today?
No, I haven't yet because I couldn't find them.
That's okay. I'll just go over the health files for the 2 new vaccines. You can take a copy of these health files home. The next time you come in, your consent will be in place for all the series unless you tell us otherwise. Okay, let's look at the MMR health file first.
Okay, now I know about measles and mumps, but can you tell me a bit more about rubella?
Yes, rubella is also known as German measles. It can cause serious complications and birth defects in an unborn baby, including deafness, eye problems, heart defects, liver and brain damage. This is called congenital rubella syndrome. It occurs in 1 in 4 babies born to women affected with the virus in the first 3 months of their pregnancy. Rubella can also cause miscarriage or stillbirth.
Thanks, that's good to know.
Now, I want to tell you about some possible side effects. Molly might get a bit of a sore arm, there might be some redness or swelling, maybe a mild fever. Some children also get a rash that looks a bit like measles. Swelling of the glands in the cheeks or the neck, which would happen later in about 7 to 12 days.
Okay. Is the rash contagious?
No, not contagious at all. Now, I need to tell you about some possible very rare reactions. These reactions include seizures caused by fever, 1 person out of 3,000, a temporary drop in the blood cells that prevent bleeding, 1 person out of 30,000, and a swelling of the brain, 1 out of 1,000,000. I mean, the chance of Molly getting any of these complications from the diseases is much, much higher. There are some children who should not get this vaccine. They are a life-threatening reaction to a previous dose of measles, mumps, or rubella vaccine, or any component of the vaccine, including gelatin, neomycin, and or latex. An immune system weakened by disease or medical treatment. A drop in the blood cells, platelets that prevent bleeding after getting a previous dose of MMR. A blood transfusion or received other blood products within the past 12 months. Do you have any questions at this point?
No, not so far.
Okay, good. Now, there is a very, very rare chance, less than 1 in 1,000,000, that Molly will have a severe allergic reaction immediately following immunization. Now, this could be hives, trouble breathing, swelling of the lips or throat. Now, we'd like you to stay in the waiting room for 15 minutes after the shots because we can deal with the situation better if it happens. And if it happens after you leave the clinic, we'd like you to call 911 or your local emergency number right away.
Okay, I'll stay in the waiting room after.
Okay. Now, let's go over the chickenpox health file now.
The vaccine provider uses a health file as a tool to guide what standard information needs to be shared with a parent or guardian about a vaccine-preventable disease. An example of this is shown in a separate video where a vaccine provider can be seen providing a parent with information about chickenpox, varicella disease. Step 4. Confirm understanding of standard information. The vaccine provider uses clinical judgment to assess understanding such as assessing nonverbal cues, assessing client questions, and clarifying the client's reasons for silence or refusing to engage in discussion.
I'm just worried about Molly getting sore arms. What do I do if they hurt?
Well, you can use a cool compress or give her some pain medication. The health passport gives you information on the dosage for her age and weight as well.
Step 5. Provide opportunity for questions.
It's a lot of information to take in, I know. Do you have any other questions?
No, I'm good.
Step 6. Confirm consent.
And are you ready to immunize Molly?
Yes.
You ready, sweetie? Okay.
Step 7. Document consent or refusal. Document that informed consent has been given or refused according to the electronic record guidelines per health authority.